Hey everyone, it's Michael over here at Home Health Success Academy. I just want to say thank you so much and staying with me for another one of our videos. Our goal here at Home Health Success Academy is to help home health agencies out there, whether you're an owner, whether you're a marketer, whether you're an administrator, DON, or anybody that's in part of the home health agency that you're in, either a Medicare approved, a home care non-medical, or even a hospice company. Our goal here over at Home Health Success Academy is to be able to help you guys and give you guys ideas on how to be able to create an amazing company in order to be able to have a successful company that you guys have. We truly believe here in Home Health Success Academy is to be able to give you guys all the information that you guys should be able to have. Like, there's companies out there that's going to be able to give you guys information. There's all over the internet. Okay, it's all over the internet on what you guys should be able to provide. And so in future videos in our home health Success University that's being released in February, we are going to be putting out over 25 hours worth of videos. That's right, over 25 hours worth of videos, from short clips all the way to clips that are 15 minutes long each. And the purpose of these videos is to be able to give you guys literally all the information that you guys need in order to be able to become successful. Because we're going to give you all the ideas, all the tools on how to be able to market your company. And then, in addition to the Home Health University, we're going to be adding more videos as well to our other sections. And what we're going to be doing is we are going to be actually showing you guys how to use the tools. Everybody says, well, you should become persuasive, or you should impress the discharge planners, the social workers, the physicians. But the question is, how do you impress them? How do you persuade them? How do you influence them? And so we are going to actually have, in addition to the Home Health Success University, is to be able to have a detailed presentation program. We will teach you guys how to positively persuade people, positively influence people, and how to be able to start referring patients to you guys. But anyways, before that, this particular video, we are going to be talking about the 7 P's of home health marketing. In addition to the home health success formula, where we literally give you guys the variety of different stages on how to be able to use and what to use in order to be able to market your company, from creating clarity to be able to have perspective, all the way out to your presentation parts. What we're doing right now here are the 7 P's, the 7 important stuff that you guys should know about home health marketing. And so, let's go ahead and get started with the first P. The first P is literally people. Second is the process. Third is the product. Fourth is profit. Fifth is place. Sixth are physicians. And of course, the 7th are power players. So we're going to be talking to you guys about every single one of these steps. So we're going to get started right away, and so that we can actually give you guys a little bit more details. And this is just a short video, and we actually go through all of these and give you more information that's going to be able to be used for you guys. And we will have it at the Home Health Success University. And you're also going to see some of these information, some of the free tidbits that we have in our Home Health Success Academy website. So let's go ahead and get started with people. So with people, we need to be able to strategize and to be able at the same time as know how to select the right people. Look, we want your company to avoid hiring people just because you need to fill in a seat. All of a sudden you have a patient, just because you have that client that needs to have a caregiver, that you automatically, hire the next person whose resume goes in front of you guys. Look, you need to be able to work and find the right people to work with your company. And before you can do that, is you need to be able to have a strategy. But before the strategy, you need to be able to have the right leaders. And when we hire people, we need to make sure that we don't just hire them right there just because they have, they have experience in the field. Just because they have experience, just because they have a license, just because they have some credentials, that does not mean that they are actually good at what they're doing. So you want to be able to make sure that they're supervised. You want to make sure you need to ask for references, because, trust me, a majority of the time, a lot of companies lose a lot of patients, lose a lot of referral sources because they bring in the bad people to work for them. And look, once that person is not able to actually work with the patient and it makes you guys look bad, do you think that a patient was going to want to stay with you? Do you think that that patient is going to want to refer to you guys, refer their friends, their families to you guys? Of course not. And that physician, how much is that going to be worth to you because of a bad employee causing that physician to be upset because they didn't take care of the patients correctly? So make sure we start off with the leadership, and we actually will go through you guys and help you guys, give you more information on how to be able to hire the right people, bring in the right team, having that synergistic effect, and at the same time is how to create some strategies. We've been hired actually to work with companies to literally interview director of nursings, interview administrators, provide them training as well, one-on-one training if need be. We also have been, asked to come in and literally interview the right marketers. Because look, marketers are one of the biggest things. You need to have marketers in your company. And if you don't, if you're one of those mom and pop shop, you're just starting off, I commend you, but you need to be able to make sure you devote a lot of time, close to full-time status when you are marketing out there. The only way a company is going to be able to expand itself is literally if you guys have a great marketing team. You may have great clinicians, but if you don't have a great marketing team, you cannot show people how amazing your company is. Okay, and when it comes to people, communication is the most important thing. Look, you need to be able to communicate with people, communicate with them the right way, and that's literally is one of our persuasion and our influence training programs that are out there. Really helps people with is to be able to know how to communicate with people correctly. I'm sure that there are people out there that when they communicate with you right there and then the first time you see them, you don't vibe with them, and it's nothing wrong with that. I mean, it does happen. I mean, we will automatically know if we will like a person within just the first 4 seconds of meeting them. And sometimes that causes us problems because maybe that person is really important. Maybe that person, is somebody that you should join with. So make sure that communication is very important for you as an owner, as an administrator, or just a supervisor, or even just a marketer. Communication is very important for people to be able to interact correctly in your office. So the next thing we want to be able to talk about, the second P, is called process, right? So what are your processes in your company and how you market and how you communicate with people? Do you guys offer, let's say for marketing, for example, because that's our major information that we provide with home health agencies is the marketing process is do you guys have a CRM, a customer relation management system? Most of the time the programs that you guys are using to bill Medicare, to bill insurances, there's a basic CRM built in there, but are you guys actually using it correctly? And if it doesn't have that type of stuff, are you guys using a CRM? I strongly recommend for a company to be able to have great communication, especially with a lot of your staff being virtual, meaning that they're always out in the field and they're not really going to be coming into the office every week, every day, every month. You want to be able to make sure that you have a way to communicate with them properly and be able to have an accountability and be able to have detailed information of the communication that's available for the staff. Now, the Home Health Success Formula, if you guys have seen our Marketing 101 presentation, it's actually in that in part one of it. If you haven't seen the Marketing 101 part 1 presentation, make sure you give us an email, info@homehealthsuccessacademy.com, or guys can go to YouTube and you'll find it in there. Very, very good 1-hour presentation, and attached to that there's an additional 2 more hours that we have. Strongly recommend that you guys actually watch that 2-hour presentation as well. The Home Health Success Formula is an important formula that I've actually created, and I've realized the moment I've created formulas and strategies that the Home Health Success Formula is something that's amazing if you actually implement that into your company, whether it's just in your marketing or at the same time it's just on how your company is run. You need to have clarity. You need to know how to present. You need to be able to know how to be able to get that perspective, and we'll go with you guys on the Home Health Success Formula. We'll show it to you guys at our marketing 101 presentation. It's also definitely more in-depth and available at our Home Health University, Success University again, okay? So just to let you guys know, the Home Health Success University is being released in February, and I strongly suggest you guys actually, make sure you look into that and actually pick it up. It's amazing. Normally these are information that we provide in our 3-day live event seminars, or these are things that we provide when we are actually hired by home health agencies to come in and train their staff, where we're there for 5 straight days. So strongly suggest that you guys are able to watch the Home Health Success University. Very, 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 very recommended. So part of your marketing, your process, what process do you guys have? What's your branding strategies? Do you guys have branding strategies? It's very important that you guys have that. And if you guys haven't looked into it yet, you need to start looking. And that's what other agencies are doing out there, and why they're actually successful is because they have a strategy and processes that are set up for almost every single aspect of their companies. Your websites, do you have a website set up? You need to be able to have a process and to be able to how to gain information, how to be able to gain information about possible referral sources who are going into your websites. So I strongly recommend that. And the third P is product. You know, your product is more than just your services. So remember, you don't have a physical store that you're selling something. So your product is literally the services that you guys provide. And in addition to the services that you provide is your staff, right? It's also part of the people. Remember the second P. So the first P. So your product is literally your staff service, what you guys provide out there. So if you're a Medicare approved home health company, you're providing your skilled therapy, you're providing your physical therapy, you're providing OT, you're providing ST, then don't forget your skilled nursing, your home health aides, your MSWs. These are the products and services that you guys provide out there. Now, if you're a home care company, non-medical, you have your 24-hour caregivers, a variety of different things that you guys should always be providing. Now, the question in your product is this: are you providing the same services that other agencies are? I more than guarantee you guys are offering the same exact ones. The thing though is what makes a company even better is if they're able to add services that is different, that is in addition to the basic services that you provide. There's home health agencies out there who are Medicare approved who are did not even apply for ST to provide or MSWs. And my question is why? Look, you need to be able to not provide less than what the other people are providing. You need to provide the same and add more to it. So, your product is very important, not just to provide the basics. You want to be able to provide additional services out there for you guys, okay? Now, let's talk about profit, which is the fourth P. So profit, what are your goals? Let's say, for example, in order for you to become profitable, what is the margin? How many, what's your census should you be in order to become profitable? Where everybody's fully paid, your office is paid, supplies are paid, the agencies, like therapy agencies that working with you are paid, where everybody's paid and you're actually able to have a profit. You need to be able to have goals for profit, and you need to start putting into that, from is 35 a census good enough for you, or 40 or 50 or 60? But in all honesty, if you're looking at the amount of census, what you need to do is you want to be able to say, I want 1,000. Look, and a lot of people say, well, I just want to stay with, 55 is good enough for me, Michael, or 100 is great for me. And I commend you guys, but here's the thing: is if you're shooting for the stars, you're going to land in the stars. If that's what you're asking for. But the thing though is, it depends on where your star is. If your star is just literally 35 patients ahead of you, well, you may not even make it there. Remember the term they say, well, shoot for the stars, but you can actually at least land in the moon, right? So look, if you're trying to shoot for 35, you're never going to reach 35. You may get there, but once you get there, you're going to be okay. And you don't want to stagnate yourself. You want to be able to always push yourself, push your team out there continuously. Truly recommend that for you guys, is to push yourself out there and understand that. If you want 100, shoot for 200. Because look, if you remain stagnant, if you see one of my videos, the 4 types of home health agencies, where I talk about you have somebody who regresses or somebody who treats, right? Number 2, you just want to stay, you want to just not do anything at all, right? You just want to be nothing. And most of the time, the people that don't do anything are the ones that doesn't have a patience, or their doors are closed already within a few months, right? And if you're that retracting person, well then, it's okay to retract, but you want to push forward eventually. And if you don't, well, you're going to end up just like a person who's not doing anything at all, okay? Now you have your normal home health agency where, that person is happy where they are. I'm happy with 50 patients. I'm happy with 100 patients. And that is actually the most dangerous position to be, is because when you become satisfied, when you have a basic satisfaction already, you're not going to want to move forward. You should always be hungry for more, and it's not being greedy, it's being successful as an agency. Because understand this, if you become stagnant, anytime that somebody walks in, anytime somebody walks in to your current referral source and is able to persuade them to start referring to them, that's going to affect you guys, and it's going to drop your census. And so you don't want to be in that position. You always want to be able to make sure that you are making sure that you take care of your current referral sources, and also taking care of future ones by finding them and providing services for them. That's what you guys need to do. The best agency to be is become the fourth one. The fourth one where you are out there hustling all the time, making sure that your staff is taken care of, making sure that your current referral sources are taken care of, making sure that you're finding new referral sources, and making sure you're planning ahead on how to find more referral sources. Look, these are things that you guys need to do in order to become profitable, is to be working harder than the average home health agency out there. Then you have your pricing, okay? When you have your pricing, these are mainly talking about the non-Medicare, the private pay home care companies. What are your pricings? I mean, you don't want to be the lowest priced home care company. There can only be one lowest priced home care company, right? So the thing though is you don't want to be the highest either. What you want to be able to do is you want to provide a great price, but at the same time let's say for example you look at what the average is, like if what are the franchise companies out there in your area, if they're charging, let's say 23 to 25 per hour for services, you want to be able to be around that in the medial area, and we can actually show you guys how to find out what is the medium charges in your particular market. There's actually a report out there that will let you guys know how much in your area is the average home care services. And what you want to do is you don't want to just provide the same services like everybody else. You want to be able to provide more value. By adding more services, more products, more programs to your non-Medicare, non-medical, or your private pay home care company, you can make yourself stand out from the rest. So you're able to substantiate why somebody is going to pay $24 an hour, or why somebody's going to pay $26 an hour. Because if they compare you to somebody else who's charging the same amount, and here you are offering more services and more products, well then who are they going to choose? They're going to choose you because they're going to be able to get more from you. Now, if you want to be able to know what additional items to be able to add products, programs to your home care company, give us a call, watch our videos. We have so many additional stuff that we're providing out there, and education and services that it's going to make your company more valuable than the average company around the corner. Your billing. Are you guys billing correctly? I've seen agencies where they bill once a month only. Look, there's companies out there who can literally bill for you and do it correctly. A lot of agencies suffer because they bring in billers who are familiar with what billing services are, but really don't know what they're doing and can't even provide the right type of reports for the people that they're billing for. So look, your billing is literally the most important part of your company. If you're only billing once a month or even twice a month, that's causing you a lot of problems. If you guys want to be able to get in contact with some really good billing companies out there, give me a call at Home Health Success Academy. I'm going to link you guys with several of them that are out there who are outstanding, who can literally bill for you every day if you want to, and still be at the same prices. The reason why companies out there have higher billers to come in once every 2 weeks or once a month is because they don't want to pay that high percentage. Well, look, for your company to stay viable, you need to be able to make sure that money is coming in continuously. The last thing you want is you billing and then all of a sudden you're getting returns on your bills, right? If you're billing for Medicare, and all of a sudden that there's denials. So you're going to wait 1 month at a time to get and find out what your denials are? No, you want to be able to make sure that you're actually out there. You have a good team that's able to provide services, but you have a great team that's actually going to be behind you and take care of your billing as well. And we talk about billing for private duty. We have a full video that's going to be coming up that's going to be able to help you guys figure out a good way to be billing your clients. Because look, once again, the last thing you want to do is wait till the last minute to bill a client, then all of a sudden they pass away, or bill them later on and then all of a sudden they really don't have any money left on their accounts. You want to be able to be smart at what you're doing when you're billing clients, okay? Now, operation costs. Look, I've walked into agencies where literally they are paying too much. And look, I love nurses. I'm a nurse myself, but as a business owner, I'm seeing a lot of agencies that unfortunately are paying too much for people that are not providing the adequate amount of work or services than what they're getting paid for. You want to be able to make sure you look into your operations costs. And actually, we've come into agencies and we've been able to help agencies reduce their operation costs by a minimum of $40,000. Imagine what $40,000 additional dollars you can have for your company. If how much is that worth to you guys? How much is that profit? Us being able to find ways for you to cut costs in your operations means more money for profit. And so we want to be able to help you guys. So we, literally a minimum we can do $40,000 savings for the average typical, if you're an agency of 50 patients or more. we can literally go into your company and provide you literally $40,000 to $50,000 on ways of saving your company. So if you want us to be able to help you guys with that, give us a call. HomeHealthSuccessAcademy.com is our website, or send us an email or give us a call. We definitely want to be able to help you guys out. So that goes with your operation costs. You want to be able to reduce that and not spend too much. And I've done it my way in the past where I've made mistakes, and I know I've made mistakes. And from me learning mistakes, I want to be able to share that with you guys and have you guys avoid from experiencing that. Because there's two types of learning. Either you do it by yourself and then you make mistakes and you say, I'm not going to do that no more, or you learn from other people who've made mistakes and who can guide you and point you to the right direction for you to be able to avoid those mistakes. So like I said, for profit-wise, you need to be able to track your billings, be able to make sure your collections are happening right, be able to make sure that you can save money with your operation costs and what you pay for services that you guys actually send out, like therapy services, OT, PT, and ST. We have actually a way for you to be able to join with other people to be able to reduce your costs for your therapy services. Next thing is we want to talk about the fifth P would be place. Where do you market to, right? Marketing to certain areas, it's up to you. Of course, wherever you're approved, that's where you're going to market to. But the thing though is, have you qualified the places that you're marketing to? And qualifying means you need to make sure that whoever you're marketing to, whether it's a physician, whether it's an assisted living, an independent living, a nursing home, a hospital, are they going to be able to send patients to you? Hospitals, yes. Nursing homes, yes. Independent living communities, you're going to be finding people there. Assisted living communities, definitely going to find people there. Physicians can get a little bit tricky, okay? So what you need to be able to do is you need to be able to detail yourself and be able to know how to target those particular areas. It is a different way to market to a physician, to market to an assisted living, market to an independent living community. Each one of them takes a different skill, a different set of procedures and processes that we've actually perfected ourselves, and works really well for people that we train and for people that that work with us as well, or has worked with us. And we want to be able to give you guys and transfer that to you guys. But make sure you know where you're marketing to, that that you qualify them, and before you go out there marketing, study your area, plan ahead. Okay, people say, well, I'm just gonna wing it. Don't wing things. Look, when you wing it, literally what's gonna happen is you're gonna experience the first way of experiencing things, and that's experiencing through your mistakes. You don't want that. You don't want to make mistakes. In this game that we're in the home health business that we're in, we cannot play any games. We need to be able to make sure we market ourselves out there and we do it correctly the first time. Because if we are not able to present and persuade people and influence people that our company is the company that they should actually refer to, well, once we've done that presentation to them, when we come back the next time, our values dropped even further. So we want to be able to go in the right way. We don't want to waste any possible referral sources, okay? So make sure that where you're marketing to, how you're marketing to them in that particular area, that you actually plan things ahead of times. Now we're going to talk about physicians, marketing to physicians, right? You need to be able to know these physicians. The sixth P is physicians. Very good place of referrals. Now, the thing though is, how do we get them? Ultimate trick. Really hard. No, it's not hard. Why? Because if you know what you're doing, then it's not hard at all. Like we said, home health marketing is not hard if you know what you're doing. And are you going to be able to close every single physician? I wish I can guarantee that. No, I can't. I can't even guarantee that for myself if I'm marketing out there. But one thing I can say is this, is that through the processes that we've had, the formats that we've created, we've actually increased our ability to be able to go out there by providing education-based marketing. And when you hear education-based marketing, the question is, what type of education? And we literally have a 12-point education-based marketing process that we do in order to be able to increase our chances with these physicians. And so we want to be able to share that with you guys. So, give us a call. We definitely want to be able to show you guys some of the basic steps that we do on our 12-point marketing, marketing process, on how to be able to get physicians to refer to us. So, physicians, which type of physicians should you be marketing to? Of course, you have your internal medicine, you have your family practices, you have your cardiologists, you have your ortho physicians as well. Those are the really good ones, especially if you're able to get into a Coumadin clinic. Those type of physicians are really good sources to be able to refer to you. But look, either or, you have to understand is that you need to be able to first qualify them, first know how to be able to attack them, and you know, yes, I said attack, but you have to attack them, right? You need to be able to, if you call them and you say, hi, I was wondering if I can come in, what are the chances they're going to let you come in? Not all the time. They're going to say they're busy. They're going to say bring lunch. The last thing you want to do is bring lunch for them the first time you meet people. Look, they're just going to use you for as a delivery boy, as a delivery service, and don't be that pizza man, okay? Don't be that, you know, I'm going to deliver pizza for you guys and then all of a sudden not get any tips. You know what I mean? Not any tips, meaning no patience. So you want to be able to go in there and be, you know, be able to persuade them. And you're going to have to cold walk in them. You're going to walk in cold on these people sometimes. But at the same time, is calling the physicians is okay, but you need to have a strategy so you don't become that delivery boy. And we literally have, you know, ways on how to be able to talk to people, talk to physicians, talk to those gatekeepers, and how to be able to get in properly and present yourself. And this is very, very important. And, you know, I should actually literally, well, actually the presentation is part of the process, so, which is the second P, right? You have to have a great presentation. You know, you need to be able to have a detailed, amazing presentation. And you know what? I challenge you guys in this one. I want you guys to make a video and send it to me, and I'm going to rate your presentation strategy. Let's say I'm going to give you 5 minutes to explain your company to me. And what I want you to do is I want you to be able to explain within 5 minutes about your services, about your company, and give me a really good presentation. And I want to be able to grade you guys and see how I can help improve you guys as well. So if you guys do that, send me a video. I would love to grade it for you guys. So, you know, make sure you're physicians, you know how to present them correctly. Lastly, the last P of the 7 Ps of home health marketing is your power players. You probably heard from other people talking about power partners. Power partners are great, but, you know, power players are even better. You want the people in the field that are playing around the field, that knows the product, knows the services. These type of power players are above the normal power players. You know, these people are going to get you to the next level. They're the ones that's literally going to be able to get you in the door because they know people already in the door. But you want to be able to help them as well, because I'm sure that there are contacts that you're going to generate that they're going to be able to benefit as well, that they've never met. Strongly recommend to find the right power players out there. Don't just rely on 1 or 2. You better have at least 10 or more in your area. You know, and if you need to add more, right? The more the merrier is always better, because you have people who are not getting paid that's going to get the word out about your organization, and you're going to do the same exact thing for them. So I just want to say thank you for attending this quick video. I'm sure it wasn't that quick, but you know, I just want to be able to start giving you guys more information. Now, you guys seen my other videos where I have white backgrounds or my black backgrounds. I'm going to be still having those type of videos, but I'm going to have it more personal, where I can make videos faster for you guys rather than going to my studio. I can go here in my desk and give you guys a presentation. So you're going to be seeing more of these type of videos in addition to my other videos as well. So remember, February we're releasing our Home Health University. Sorry, our Home Health Success University. We're releasing our presentation program on how to be able to create an amazing presentation in order to be able to get doctors to start referring to you. We're also going to have our body language communication course. This body language course is literally part of our communication series that's going to be able to help you guys become better influencers, become better presenters as well. So strongly recommend that. All the services that we have, we're going to be releasing it to you guys, and we want you guys to start using them, because that's going to be able to guarantee your success as a company. So I just want to say, home health marketing is not hard if you know what you're doing. I just want to say thank you so much for attending another one of our videos. I hope you enjoyed this video. We're going to be coming up with more. We're going to have short ones, we're going to have long videos as well, and we're going to have this available for you guys all the time. So once again, this is Michael with Home Health Success Academy. Thank you so much for joining us for another one of our free videos. Remember, give us a call, 630-340-8990. Email us at info@homehealthsuccessacademy.com, or you visit our website, homehealthsuccessacademy.com. If you go to YouTube, make sure you like all of our videos. You know, put comments. We want to be able to hear from you. And in our videos, you know, go to YouTube and literally put home health marketing. Just search home health marketing. You're literally going to see 90% of our videos in the first 6 pages of YouTube. And if you guys want to be able to learn techniques on how to get yourself out in the first few pages of YouTube, make sure you go ahead and, you know, start working with us. And we want to be able to show you guys how it's done. You know, it's an amazing thing. We want to be able to work with you guys. I want to say congratulations for attending another one of these videos. Thank you so much, and you guys have a beautiful day.